I'd like to invite our second panel to come on up. Unfortunately, Ali Smith is not able to be with us today, but we have Debra Hickman, the CEO from Sisters Together in Reaching, Tamar Mendelson from the Bloomberg School of Public Health, speaking about the Urban Youth Yoga and Mindfulness program, and Leon Purnell, the director of the Men and Family Center, will be the third member of the panel. So I'd like to invite them up to the front. And we'll get the presentation set up. And Reverend Hickman, you'll be on first if you want to come on up here.
Good afternoon. I hope to be not very long. I've been invited to talk to you about the East Baltimore Health Enterprise Zone, our collaborative that we actually formed back in August of 2012. Can you hear me now? Okay. And so here at the start of the presentation, you actually see a couple of logos from some of the collaborative members, but organizations, but not all of them. There are actually far more than this, but we don't have all of their logos. So I want to start by telling you about the East Baltimore Health Enterprise Zone collaborative that was developed in August of 2012. And then fall of 2012, from August through December, we worked intensively on the Health Enterprise Zone application, which I'll tell you a little bit more about its formation. I kind of got my slides a little out of order, and so I just will go through them the way that they are, but make sense of it as I go. December 2012, we presented the proposal to the Maryland Community Health Resources Council, and then in January of 2013, the funding decision was made, and we were not one of the applications that were awarded, but we remained in the fundable category. In January 2013 till the present, we, as the collaborative body, continue to meet to identify alternative funding sources. In March of 2013, as a part of that continuing to identify funding mechanisms, we began to work with Johns Hopkins Community Health Partnership to take parts of our proposal that we had proposed to the state to ask them if they would fund. And the parts that they are at this present moment funding, I'll talk a little bit about a little bit down in the presentation, but it is called Tumaini, which is Swahili for hope. And the project's total name is Tumaini Hope for Health. October 2013 is when we have begun, right at this present time, to implement. The vision of the original East Baltimore HES Collaborative was to develop, implement, and sustain a neighborhood-centered initiative targeting social and economic determinants of cardiovascular disease with a specific focus on improving access to and reducing the cost of care. As already stated, in hindsight, we would have gone back and said that we were going to actually be looking to target social and economic determinants of health with that specific focus of access to and reducing the cost of health. So the Health Enterprise Zone actually was an act that was formed by the Maryland Health Quality and Cost Council Health Disparities Work Group that was established by the Lieutenant Governor Brown and was led by Dean E. Albert Reese of the University of Maryland School of Medicine. The act was the first bill that was signed into law by the governor on April 10th, 2012, and its implementation was under the leadership of Lieutenant Governor Brown. Its objective was to actually provide $4 million in new funding to the Community Health Resources Commission to fund health enterprise zones that would actually incentivize providers in those areas so that they would be able to address the health disparities that were taking place in those areas that had at least 5,000 or more persons that were considered in an oppressive state of health and wellness. And so prior to this act being signed into bill, there were a total of 4 of us, Leon Purnell, Willie Flowers, as well as Michael Scott, that had gone down to Annapolis to testify on many occasions that the incentives were being done in a wrong way, that they should actually be incentivizing the members that live in community that would be greatest impacted and not giving funds over to providers that it was not going to make an impact. So the purpose of establishing those health enterprise zones, again, was to reduce health disparities among racial and ethnic groups, improve healthcare access and health outcomes, and reduce healthcare costs and hospital admissions and readmissions. And so each has had to be a contiguous geographic area. They had already decided that they were only going to be giving out 5, and we had met to have wrap sessions with our Baltimore City Health Commissioner to even inquire as to whether or not one on the east side and one on the west side could come together as one, since there were only going to be a total of 5 given out throughout Maryland. And so the answer to us at that time was no. So we then became in competition with each other. So the realization for us forming our East Baltimore Health Enterprise Zone was to build sustainable partnership requiring community-wide support in order to succeed. And so that partnership needed to have coalitions, it needed to have collaborations of key strategies for promoting the health and wellness and delivery systems of social services associated with healthcare delivery as well. So our East Baltimore Health Enterprise Zone was and is linking and bringing institutions, organizations, community residents, businesses, the faith community, the school system, the social service system together, and mutual beneficial relationships to conceptualize the proposal, develop responsibilities and contributions to produce extraordinary create a proposal with positive results. And I really feel like we were very fortunate in this regard because we did have an excellent, as you will see in a moment, excellent collaborative body that formed. We did not leave anybody out of the process. The doors were open. But the one thing that I will say that we didn't do well is that we did not use all of the modalities that were available to us to make certain that everybody in community knew, either that they heard it on the radio, they saw it on the television, or they got a newsletter, but we relied on some people to say that they were reaching out to others, and so that might have been a restrictive process. So we know that effective partnerships required, and this is what we had and have in our East Baltimore Health Enterprise Zone, is structure and respect, shared leadership, responsibility, and oversight, that our relationships were central, inclusion was intentional, balance was struck between trust building and action. And what I mean there is that this was not a driven process that was just by the community residents or the community-based organization, but it was also with the community institution that exists as to the reason why we are here today. And that was when we first, that body of 4, we went to Dr. Blum to say that this was a grant that we were interested in writing, and Dr. Blum was very instrumental in getting us to come before the provosts as well, that we did not know that Hopkins had already begun working on a process. And so the 2 persons that were working on that grant, Ann Langley and Dr. Hunter, came to our community health initiative meeting to talk about this particular proposal. And so there have been several things that have happened that brought about the trust, the structure, and the respect, because in the development of the Health Enterprise Zone, actually, I want to call her doctor, but Ann Langley, who is not here, who actually works for Johns Hopkins, was the co-partner in this in terms of co-leadership that really made it a formidable structure, because the other part of the situation is that as community-based organizations, we did not have the technical capacity to write a technical application. And so also we needed to have clarity and understanding. And that clarity and understanding of mutuality, vision-guided structure, and attention to planning, communication, training, orientation, and preparation. It required a lot. It required us to know what were the stats that were driving the numbers between cardiovascular disease, what were the disparities that were impacting the community neighbors, what was the language that the people understood or would not understand of the things that we were talking about doing with the with the East Baltimore Health Enterprise Zone, which brings up the fact of governance. We did not establish an effective governance structure as we went along the way because we were so engaged in getting the application together and so caught up in trying to get our budget together that we were last minute in developing our structure. But we stayed together as a group and we had mutual respect for each other, and we developed a plan of action by which we knew that if we got funded, it would roll out appropriately. And we felt as though the word was around the city, it was around the state, that we had a very rigorous application that the state would want to consider and want to fund. So we said that we were using collaborative governance, one by which we had a commitment to the collaborative. We had co-defined the dilemma. We all were in agreement that we had picked the right entity, the right disease to focus in on cardiovascular disease, that we co-designed the process together as institution and community-based organizations and community residents, as well as the educational system that was sitting in the room, that we came up with a solution together and that we were able to deliver the actions that we had planned in that application together that would have overall big-time solution. So building a collaborative was multidimensional and recognizing opportunities for change in the university structure, change in the community neighborhoods. And you keep hearing me say change in the in community institution and community neighborhood, because I do believe that we need to remove the us and them of community, that community is not just the people that live in the neighborhood, but it is all of us that work together for the total benefit. Whether we work or we live or we play, we are one community. But when we give power to us over them or them over us, then we start a losing streak. But we have been building a bridge. And so we chose, as already stated, an effective group structure. We were able to mobilize the people as well as the resources needed to be able to bring about an effective East Baltimore Health Collaborative. We developed a vision of long-term range. When we did not get funded, we did not give up. We ensured a broad-based inclusive partnership. We reached out and continue to reach out so that we can make certain that everyone is at the table. We are in the process of doing some things now that will also help people to still be engaged and want to be further engaged in the health enterprise zone. So these are just some of the members, the 30 members or so that were involved at the table and that are still coming to the table in one way or the other. And as you look through the list, you'll see that there is the school system, that there is a health delivery system, that there are community-based organizations, that there are community associations, as well as that there were people there representing just the general neighbors in the community. So our overall goal in the HES was to reduce inpatient hospitalization, emergency department visits, hospital readmissions, and associated costs due to cardiovascular disease and related illnesses, to reduce unequal impact of cardiovascular disease, improve community and service provider proficiencies. And so we stayed in alignment with what the overall intent of the Lieutenant Governor was and still is. And also, it is a part of the Baltimore Healthy 2015 plan. It is a part of the Affordable Care Act. So we felt like we've been being very innovative in our processes. Our selection principles that we had to deal with were purpose, description of need, core disease targets, goals, strategies, cultural competence, balance, coalition, a work plan, all of which the greatest of these is number 11, sustainability, because after a 4-year period, the money is going to go away. Will we, as the community-based organizations and the community institution, as well as all of the other players, be able to sustain ourselves afterwards? And I would say that yes, we can, because we're already starting to build that sustainability structure. These are the zip codes that we had decided that we needed to target: 21202, 05, and 13. So to address the disparities, we actually planned on educating the residents about the importance of change and the possibility of help, supporting them in seeking needed care, adhering to prescribed care, and embarking on a path of behavior change, strengthening networks to extend the reach and endurance of the intervention, and changing the culture to one of wellness and all of its possibilities, meaning that we want to leave the community with the capability of sustaining itself, because it will continue to reach out to its neighbors well beyond a funding period of making sure that everybody has access to health information as well as wellness. So on a multi-level, community-based level, what was planned in that grant was that STAR, the organization that I founded and still am leading, would actually hire the community health workers, and the Men and Family Center, headed up by Mr. Leon Purnell, would hire the neighborhood navigators. The neighborhood navigators was the strong point to the grant in terms of actually being able to reach into communities one block at a time, block by block, door by door, to actually check in on neighbors, to outreach to them, to be a resource connector, a social support to the neighbors who live on and around their blocks in specific neighborhoods with the target zip code, and that they would be provided with a stipend. They were not being asked to do anything free, but they would continue to get education on health-related issues from the community health workers that would be employed, and the community health workers would be able to go in and help the members in community to get back up on their feet, as well as help to develop family-centered care in the home to care for that person, and making certain that we were able to reduce their lack of medication compliance, as well as to make certain that they were able to be compliant to all of their medical regimes. So the collaborative still sticks together at this moment, has already been stated. The collaborative members have worked with Annie E. Casey Foundation to look at how we can get parts of our grant funded. We have worked with Hopkins, and we are now being funded to provide Tumaini Hope for Health, as well as that we have other funders that we are going to make certain that all of the members at the table that wanted to have a part in actually making certain that the community stood up as healthy and well, was vibrant again, that they are going to get their parts funded as well. So the takeaways are is that we're going to provide motivation for the formation of a broad-based, community-led collaborative committed to health improvement, that the collaborative has grown beyond the bounds of a single funding opportunity, and that the process has demonstrated ways in which technical expertise can support a resident and community-based led organization. And so for me, it has been really a wonderful ride between the university and the community residents. I think that the takeaways for me personally have been that language is a barrier, and that we can't hear sometimes when people aren't speaking the same way that we are used to hearing, as well as that cultural competence, really, I have a question about as to whether or not it really is a true something that we should really get into, because within a culture, there are subcultures, and there are subcultures in the subculture that create tension. And so I challenge all of us today that when we're at the table, not to get stuck in something that really is not real and we cannot do a whole lot about. You're not going to change an old goat that's been around hoofing his way through the field the way that he hoofs, because you are of the same color or of a different color, whether you're from here or you're from there. But what we do have to do is, I call, have respect for one another at the table. Respect to listen, respect not to name call, respect to be able to do the work that everybody has been assigned to do, to make sure that there is equity at the table in everything that we do. So my concluding thought is that the partnerships that we develop with Hopkins, the community institution here, involves members from different disciplines, races, genders, intelligence, and cultures, and the greatest challenge is to create equality and satisfactory work relationships, and that you get what you give. If you give nothing, you get nothing. If you cannot be integritous or transparent and be allowed to be yourself, then you are just adding also to the problems that already exist. Thank you.
Thank you, Reverend Hickman. I'm not going to ask who the old goat is. We can talk about that later. But next up, we have Tamar Mendelson from the Department of Mental Health at the Bloomberg School of Public Health. Come on.
Hi, can you all hear me? Great. So my community partner, Ali Smith, texted me and said his son is still running a fever. He doesn't have a babysitter. He's really sorry that he can't be here. So this is not our model of community academic partnership that I'm going to do all the talking for Ali, but that's unfortunately what it will be today. So I'm going to talk a little bit about who I am, who Holistic Life Foundation is, and the work that we've done together. And then I'll try to tell you a little bit about some of the challenges and the opportunities that I think I've experienced, and also that Ali and Atman and Andy, my community partners, have talked with me about. And we actually have been, we recently wrote a paper together, sort of a community academic partnership paper about our experience doing this work together. So that's fresh in my mind. So I'll share with you sort of some of the conversations that we've had about that. So I'm a clinical psychologist. A lot of the work that I do is around promoting mental health for adolescents, young adults, and also for pregnant women and new moms. A lot of that work I'm doing in Baltimore City with underserved populations. And in my own life, I had an interest in mindfulness and yoga for many years, but it wasn't something that I was actively working on until I was fortunate enough to meet Ali Smith, Atman Smith, and Andy Gonzalez, who are the founders of the Holistic Life Foundation. And it was actually Dr. Philip Leaf who introduced me to the Holistic Life Foundation, and also to my other academic partner, Dr. Mark Greenberg, who's at Penn State University. And we had an initial meeting, and I learned a lot about Holistic Life Foundation's work. And they have been working in the Baltimore City community and beyond for over 11 years, and they've just been doing incredible work with youth, but really with people of all ages, training them in mindfulness and yoga techniques, and really trying to teach people tools and skills for enhancing resilience, enhancing ways of coping with stress and difficult situations, and sort of building more and more capacity to observe what is happening and tolerate it and do something positive with it. So they talked about their work, and they were really interested in getting some numbers behind what they do. They hadn't done any research, but they were seeing incredible benefits in the kids that they worked with. And in particular, they told me about the initial cohort of young men. There were boys at the time when they first met, about 20 young boys that they first worked with. And over the years, they kept in touch with these boys, and 19 out of 20 of them went to college. The 20th, I guess, had I think a GED. They were all employed. They had really done well and continued to practice. And many of them came back after college and began to work as trainers and teachers with the Holistic Life Foundation. And actually, I met a number of them in our work together because they're now assistant teachers of yoga. So, they were really seeing incredible changes in these young men, but didn't have sort of formal research behind it. And so we talked about creating a partnership with the goal of trying to study some of the impact that doing yoga and mindfulness might have with youth in Baltimore City. And we also wanted to try to embed their program within Baltimore City schools. So some of the work they did was in after-school programs, some was during the summer or in community settings, and some was in schools. And we were especially interested in seeing if we could have the program delivered during the course of the school day, whether that would be feasible and whether administrators and teachers and parents would like that. And with the idea that maybe we could get funding to create a more sustainable, sort of large-scale use of yoga and mindfulness in Baltimore City schools or beyond. So we met with that goal, and we were fortunate to be able to get funds through Dr. Philip Leaf, is director of the Johns Hopkins Center for Prevention of Youth Violence, and we were able to get funds to do a pilot study on their program. So we worked at first with 4 Baltimore City public schools, and we offered the program to 4th and 5th grade students at 2 out of the 4 schools. And we had about 100 students overall in this project, so about 50 of them got the program in the first year. And we did some basic surveys with the youth before and after they participated in the program. And we found that being part of this program enhanced, students reported being able to respond to stress more effectively. So in particular, they had fewer worries and intrusive thoughts and rumination and lower kinds of emotional arousal and things like that. So it looked promising that this program may actually be helping kids be able to regulate themselves better in response to stress and have some positive outcomes. And I should tell you a little more about the program, too, that basically Holistic Life, they've led programs that are different lengths, but in this case, we worked with the students over about 12 weeks, 4 times a week in 45-minute sessions. And the yogis would start with a period of breathing, and then they would do active yoga-based movements, which, just having observed some of the classes, I think was really good for this age group because they came in with tons of energy running around the room. So they did these active movements, then breathing techniques, and then there would be information about stress and how you can use breathing and yoga in response to stress. And then near the end, there would be a few minutes of guided mindfulness practice and learning to train the attention. And these practices could be focused on things like following the breath, or sending positive energy to other people, or imagining yourself staying calm when you're about to take a test in school. And then the yogis would also give assignments to the kids to teach other people, family members or friends, to do some of the movements or practice noticing new things or using the breathing techniques. So that was the basic structure of the classes, and they also would build over time with the skills that they were teaching to the kids. So after we got sort of our initial encouraging findings, we were able to apply for a grant from the National Institute on Drug Abuse, and we're now in the midst of the 3rd year of a 3-year study where we're expanding on that initial pilot study that I talked about. And so I'd say I hope that the partnership continues beyond this study. As others have spoken about, the issues of money and funding are so critical sometimes to being able to maintain some of this work that, at this point, we're sort of still looking toward next steps with that. But, I think that there have been so many productive parts of being able to work together. And I know it's become sort of the project that I'm most passionate about of the work that I do. So I'll talk a little bit about sort of some of the challenges, some of the benefits so far in terms of our experience. So I think probably, if Ali, Atman, and Andy were here, and I should say also that this publicity brief that's in your folders tells you a little bit more about Ollie Smith and Ottman Smith are brothers, and together with their friend Andy Gonzalez, they founded the Holistic Life Foundation, and this brief gives you some information about the organization and the work that they do. You can also check out their website, which has a lot of information about them, as well as some of the research that we've done. So I would say that one of the challenges for all of us probably is just communication. So we're not only sort of a community academic partnership, but there's a lot of academics involved because we have Penn State University and we have Hopkins, and one of our Hopkins partners is now working with the serve centers through UNC Greensboro. So there's a lot of us, and sometimes just getting everybody on a conference call or sort of making sure that everybody is up to speed is challenging. And so we've developed sort of ways of, Ollie and I text a lot to sort of check out what's going on, or I'll have communications with different members of the team that aren't, we can't always all come to the table together, and that has been a challenge. And I'm still learning about how best to kind of keep those channels open. And I think particularly when community members and academics have different things going on, it's really important to keep each other informed. Is there a conference coming up? Is there, something happening with Baltimore City that Holistic Life is involved in? And so I think, I've certainly learned a lot about the need for that and how to do that. I think other challenges, so for me, a lot of interventions are developed by academics at a university, and then they get sort of applied to the community and tested in that setting. And so the academics really know what they were thinking when they did the intervention, and they might have a theory in mind. And with this program, I think one of the great strengths is that this is not a program developed by academics. This is a program developed by people who were born and raised in Baltimore and are very familiar with Baltimore City schools and with the culture of youth. And I think as researchers, we've had to really stop and listen and try to understand what are the core building blocks here. What was the vision as the intervention was created, as this program was developed, and how can we make sure we really understand the intervention developer's perspective and not just impose our own agenda or our own understanding of what this program is about. And that's not just a single conversation. We've had multiple conversations about this, and it's actually been a sort of a central issue in how we assess the fidelity of this intervention. So how do we come up with a coding system to show that the leaders of the program are actually doing the program the way it's supposed to be done? So to do that, you need to have a really clear understanding of what are the core components and how do we evaluate whether they're being done faithfully or not. And to do that, we had several conversations with Ollie, Ottman, and Andy, and it's been a very interesting process where I feel like both the researchers and the practitioners have shifted somewhat in our understanding of sort of what are core components of the intervention and how can those best be taught and communicated and evaluated. So I think we all sort of felt like those conversations were very valuable, but maybe less straightforward than if I just sat down and come up with the intervention myself. And I think too, I really enjoyed hearing the earlier speakers' comments about transparency and about setting up partnerships from the start that are equitable. And I wish that I'd had all of these guidelines and bylaws when we started, because I think, that for me, I have learned, I feel like I've made some mistakes about transparency in terms of the budget, in terms of some of the ways we disseminated data. And Holistic Life has been really wonderful about talking with me when something happened that was maybe a pinch moment. And so I feel like I've grown a lot from that and would like to keep growing. In terms of what Holistic Life has told me about the challenges of working together with researchers, for one thing, it's more work because we're giving them sheets to fill out after each session with attendance and engagement of the students. There's record keeping that they wouldn't normally do. I think the benefits of that are that it ends up informing their understanding in some ways, because even though they're noticing these things, when they have these records over time, it actually is informative. And there's just sort of more guidelines they have to follow. It's more important to follow a strict manualized curriculum, set number of sessions, and I think probably even more perhaps challenging is the fact that when we enroll students in a randomized trial, we can't have students shifting in and out of the class. So sometimes a student who didn't initially want to be part of the program decides that they do want to be part of it midway, or students who were initially signed up are not that invested. And in their regular work in the community, that would not be an issue. Students would flow in and out, and it creates maybe an environment where everybody is more enthusiastic on each given day about being there. And so that was a challenge, I think, for them that was a bit different. In terms of the benefits, I think that we've all come to appreciate the way that the practice, that an intervention that's really based on intimate knowledge of the Baltimore community has great strengths. And I think that Baltimore City school administrators and others have shown great interest in this program, partly because it does seem to have made a very good connection with youth and also with teachers and administrators. So I think that that's been a really important component. And then the research has, I think, helped to promote the practice. So when we published our outcomes paper, we were fortunate enough to get covered in the Baltimore in the Baltimore Sun and in other newspapers, which led to Holistic Life appearing on NBC Nightly News, and there was really increased visibility for their work, and they're getting more and more invitations to lead trainings and to do work, and I think now their biggest challenge is sort of having enough people power to do all of this and starting to think about how to continue trainings and so on. But I think that the research has helped with visibility, and then in turn the practice has helped inform new research ideas. So I need to stop, but I think the one thing I would want to say in addition is that probably the biggest challenge for all of us wasn't the partnership between Holistic Life and Hopkins researchers or Penn State researchers, but the additional partnership with Baltimore City Schools, which is so critical for being able to implement programs effectively. And there are a whole host of other challenges that go along with partnering with schools where you have so much turnover in administrators and teachers. So I think that this is another area that we all have agreed to keep thinking about, is how can we not only strengthen our own partnership but really build stronger bridges with schools to continue this work in an effective, sustainable way for the schools.
Thanks. So our final member of this panel is Leon Purnell, who is the Executive Director of the Men and Family Center, a lifelong resident of East Baltimore, who, in addition to leading the center, directly impacts health disparities through early detection assessments and the teaching of life skills, pre-employment skills, and other things. And he'll be speaking about CHI, or about both the Men and Family Center and the Community Health Initiative.
Good afternoon. It's a little awkward, all these females in here. I think that was a problem that should be addressed, Robert Blum. I'm going to talk today about a few things. The collaboratives that the community's had with Urban Health Institute, various collaboratives they've had with the hospital in general. And in listening to the presentations before, you all brought up some really, really valuable points that I've been trying to drum home for a number of years here about the need to value the community's perspective. And I'm sorry that Darius is not here, because he and I have been working on this for a while as well. the value that the community brings is as equal as the academia you present on the other side. And today, I didn't do a PowerPoint presentation because I want you to listen. And maybe it'll get to some other people. And we often get caught up in the PowerPoint presentation and we start playing with our phones and so forth because we can do other things. We got the PowerPoint. But today, if you want to know something about this, you got to listen to it. And when we talk about community participatory research, when we come to the table as a community, we expect that we're going to be treated equally. We expect that we will be valued in our participation. The young lady said something earlier about funding for community people. That's important. If you're being paid and you're there, that's really good. But you know, you're going to show up every day happy and eager because you're getting paid for it. But when the community come and they're not compensated, there lies a problem. There lies a reason why most of them don't come back as often as they should. The problem that we've had with the CHI, the Community Health Initiative, is along those lines because we have very few community people that wanted to participate in this. That's why I'll give kudos to Reverend Hickman because the HES piece, we actually had a head start. She didn't tell you that she got funding from an outside organization to bring all these community people from West Baltimore and East Baltimore together for a real nice dinner. They got drunk and everything there. She didn't tell you about that. That was an advantage that most community programs don't have the luxury of. Because when we had our child thing, we had a nice meal, but it wasn't like what we had down there. And the people didn't come back because they didn't hear about any money. And the community is often scrapping to sustain themselves. And I'm sure you all know what I'm talking about. My program, often struggling, but we're still there after a lot of years because we don't have to have a lot of money to do what we do. We just got to have the passion. It'd help if we had some money to support it, and it would even strengthen it more. One of the things that we're going to talk about now is some of the challenges that I've seen with the collaboration of the hospital and the community. One of the biggest challenges is identifying the people to come to the table. I don't know how Reverend Hickman did it. She just pulled people out of the air. And when she said the restaurant and free meal, I think that was the attraction. I don't know if it was just her calling them. But we had a cross-section of people from almost everywhere you could think of, hospitals. We had CBOs from all over the place, common people from the community that cared about it and wanted to be a part. We had a whole lot of people there that made the difference in the HES thing and the community's CHI piece. That's the acronym that they use. I know somebody said don't use acronyms. I agree with you because they often stun me with that. The Community Health Initiative, I'm going to follow that lead. Egos. One of the biggest things that hurt most collaborations is people's egos and not being able to listen to other people and respect their point of view. You know, we come to the thing and we seem to think that our perspective is the perspective. And that's not always the case. I know some people that were homeless that helped me change my whole view for my program. Because I had focus groups with homeless people because I wanted to know what really caused some of the problems in East Baltimore. Not what I saw or what I could identify, but I wanted them to tell me firsthand. And that's important. The other thing is making sure that the things that you bring to the table is holistic. Sometimes we get caught in one track, I guess, directional thinking. With the tribe, many of the people that I talked to argued that they didn't necessarily want to do those subgroups that we had. And I don't think the community had the proper opportunity to frame that direction. And that was important. So that's a challenge. The community's focus. What is really the focus of the community, and how do we put the two together? Because when hospital and academia come to the table, they have specific things in mind, what they want at the end of it, whether it's a paper, whether it's some funding down the road because they know about something that other people don't know about, but they have an agenda. How do the two agendas meet? One of the presenters said real eloquently that they have to be common and that they have to be something that you see as a benefit to both parties. That is really important, and I hope all of you take that back to whomever you represent and let them know that that's really important. Then there's the fact about the meetings. If you have meetings early, you're not going to get very many community people. And if that's when most of your decisions are made, you already made it clear to the community that this is not their agenda. So they're going to leave the table and they won't be there. How do we, I guess when we talk about boundaries and things like that, we often have to think about the capabilities of really accomplishing what we want if we set certain boundaries. If you cut out the people that could actually do all of the things because you have boundaries that just focus on half of that area, then you're losing what you probably have to have there if you want that holistic approach. So we need to think about that. When you bring people to the table and you send them through all this planning and so forth, paying them like you're getting paid when the money is there already and you know it's there, pay the people. You have people that have bills just like you, and to minimize that and not take it into consideration is an affront, and it often causes friction that diminishes the work as we go along. So if the money is already there, make sure that you have enough initiative to get people paid, because their time is as valuable as yours. Values in this. One of the things that Darius and I had talked about was how do we make community programs sustainable so that whenever there's a research project or a collaboration that's generated or they want to generate, they don't have to search for a partner. They already have a legitimate partner there in place that has the things that's needed to accomplish whatever mission they have in mind. But if you don't build their capacity and you just give them some crumbs here because you just need a little bit of information, at the end of the day, you have a broken system. You still got to rebuild. When you come back for something else, you got to rebuild it. If you make them strong from the beginning, when you come back, you may find that you have less to bring to the table because they have just as much there already. Now, I made a lot of notes about what I heard because I was really fascinated about the bowl. And if you listen to what was said about the bowl, you know, you have this area outside and inside, and they both have a function. That's just like the community and the hospital. We call it the big house on the hill down here. And we say that for a reason. I grew up a lot of years around here, and people have a lot of different stories that they could tell you about the big house on the hill. But the one thing that I want to tell you about the big house on the hill is that they need the community now just as much as the community needs them. And one thing that was really impressive with this Affordable Cares Act is that they actually put verbiage in their grant that said that you have to have community participation. Therefore, you see us at the table with Tumaini. Without it, we probably wouldn't have been there, because one of the things that was also said here today was vocabulary. But let me tell you that there are some people in academia that changed Webster's definition of a word. I want you to know this is the truth. We were at a table for 6 months, and they kept saying community. We said, yeah, finally. They got the message. They talking about us. They said community. We said, okay, they talking about us. And then we went to one meeting, and we sat there, and I said, ho, now you saying community, and then I don't hear us in that equation. And their definition of community was their programs and their buildings that they put in our communities. And for years, I've been hearing from Hopkins that there's $8 million a year or $10 million a year going into the community. And I said, where in the... And I kept looking around, and I kept asking people, and I kept saying, do you see it? I don't. Now that I've been to the table and I actually talked to them, and I found out that this building they just built around here probably cost $3 million. You know, these are the things that they're talking about as community, and that's a big difference. We should understand that when you talk about community, you can't just change Webster's definition. And that ain't right. So if there's a lesson to be learned on both sides, is we got to find out exactly what you mean. When you say we working on the community, we're going to rebuild this part of the community, so we need to know what you mean by community. Spell it out. Because I would never be at a table again that long and listening to people without knowing specifically what they're talking about. That was a true lesson learned for me. And it will be for anybody that I'm associated with, because they're going to hear it every time. Hold up, let's write it down. I want it on the board somewhere. Exactly what you mean by community. Exactly what you mean by community people. You know, I want to know, if you're talking about your staff going out there, that's not community people. So, challenges. We have a lot of challenges, and we have a lot of values that we've gotten from these presentations. I don't like being redundant, but I want to go through one other thing about the lessons learned. Equal value. Bob Blum and I met a long time ago. We had an initiative where we was going to do a needs assessment for East Baltimore. And we instituted something that was unique. Co-investigators, one from the community, one from the hospital. We need more of that, because the value that Glenn Ross brought from the community was as valuable as any doctor that was in the room, because he had multiple years of history of running organizations in the community, being a part of the community organizations, working for 3 or 4 different mayors. So the knowledge that he had was, it would stack up with any amount of books that you had in your classrooms. So let's start thinking about people on an equal basis and giving people the just due that they deserve. Common goals, again, I'll say is another lesson learned. We really got to look at, and the piece that they brought up about having the project not be named after that particular grant. I wrote that note down. I said, boy, that's smart. Because when that grant goes away, so does that name and so forth. But if we look at what the alternate goal is, what the long-term goal is, and just name something, maybe it's a step towards. This grant could be a step towards that. But we want to start looking at the long-term project, and maybe if we come to the table with Hopkins or university or anybody else, and we bring that concept to the table, we can change some of their thinking. Right now, we're trying to change the community's thinking, because for years, they've been without health care. That's been low on the totem pole, behind rent that they got to try to worry about getting paid, or gas and electric, or what have you. Most people have pushed that low on the totem pole. So now that they have the Affordable Care Act, the health needs to rise a little bit, and we got to change the mindset so that they can understand that now you can take some charge in your health care. You have a card you can carry in there and put it on a thing and not be looked at as a third-class citizen because you don't have health care like you've been doing for so many years. When they go to the emergency room and they be seen, the doctor tell you, well, you go to your primary care for follow-up. Who is their primary care doctor? If you don't have health care, who's your primary care doctor? The emergency room. So you end up back in the emergency room with that big bill for no reason. So lessons learned, we gotta change a lot of different things. I hope that you have a lot of questions, because I got a lot of answers, but I won't stand up here and keep going through this, because I got some ammo in here. So I thank you.
Monique Armstrong. I actually work for Baldwin City Schools and as a family and community engagement specialist. And so part of my work is working with schools to support partnerships with universities, community, and others. So I'm open to hearing from you and whoever else might be in the room about how do we support our schools in being ready and prepared to receive you all when it's time to make these partnerships. Since you mentioned, Ms. Mendelson, that some of the work with the school leaders or persons in the school may not have the capacity or ability to always be prepared and ready to accept these kinds of partnerships, because we know there's such great things happening in the community and there's a lot of things happening in schools as well, and we want to make sure we can build and leverage what's happening. So any keys that we can do to really prepare our leaders to prepare?
I'd love to talk to you after this. I mean, basically, our experience has been that teachers and administrators are so overburdened already that it's really hard for people to take additional things on. And so I guess what would be great in terms of developing partnership with schools is thinking about how to integrate new programming or initiatives in a way that can be integrated into professional development time or CE credits, or things where teachers will get something back from that, even before hopefully seeing benefits with their students, that there would be some way to sort of either compensate or build it really into the culture and the climate of the school, rather than having this be an additional thing on somebody's plate. And I think we've found it's very helpful to have relationships with sort of the central Baltimore City School administration, but I think also having other liaisons or ways of talking about this and ways of coming up with plans that are sort of agreeable for schools and for practitioners or researchers would be really important. It's so hard to have those conversations now, even when we sit down with principals, just because of how busy everybody is and how things change so much year to year.
I would add to that I actually think part of your school curriculum should really get back into having them be a part of civic programs, and through that you'll have an automatic connection. If we start with the kids, when they get to be adults, they already have an engagement. And that's what we have a problem with now. Most people won't come to the table if money's not mentioned. And if they understood more about how they can affect change by being at the table, opposed to waiting until something is already put in place, I think we have a better chance of changing things in our communities. So, it don't always have to be the teacher. It could be the aide, and they can bring a couple of students with them. So, but civics need to be a part of the education process, and if we don't change that, we're not going to change the way people look at the way things are happening. Just like voters' rights, we can't get some of these clowns out of office unless we have people understand that they have value in voting.
Good afternoon. My name is Unique Dvorsky. I'm also a family and community engagement specialist for city schools. And I think my question is really a follow-up to what Monique has said. My question is, on our side, I think we have some of the same goals that the community partners have. I think the difficulty is being able to navigate the systems for us to connect with community partners so that we can bridge those gaps for schools and really get the services in, because that's what we want our students and families to have. But it's not the easiest to get connected with the partners and really make things happen in a timely manner. So any suggestions on those?
So one of the things that we have found, we have worked with Alexia McCain at the Baltimore City Public School Systems, and a lot of it, while the principals have autonomy, when it comes down to introducing certain programs and wanting to work on certain projects, then North Avenue gets involved and says no. So there is autonomy and then there is not autonomy, and so it makes it very difficult. And so we need to play by the rules and to actually be able to engage both outside of the school system and in the school system. We need to understand what is the language and what is the protocol to be able to introduce something at the beginning of the year and not in the middle of the year, and so that we can actually kick it off and really develop that relationship that you all are talking about of engagement, because there are lots of opportunities and we really want the youth engaged, not just at the middle school and the high school level, but really it would be great if we could start doing some things at the grade school level all the way through grade 12, but we need how do we actually get on the inside instead of someone coming out when they need something? Sometimes it becomes in Baltimore City school system that they might look like what they say Hopkins does: when you need us, you call us, but when you don't, we don't hear from you. And so we need to be partners together and letting the community know that these are some of the things that you're looking for, and the community also letting you know that we need these things, and how do we go about making certain that it happens.
I'm a community leader, been a community leader for years, and with that, I facilitate several meetings, and I have yet to get the schools within the community at the monthly meetings. I don't know if it's because you need comp time or what it is, but clearly that's one way you can get involved. And I'll talk to you today before you leave, because if it can be a process, east, west, north, south, that the schools will have a list of when the community meetings are in their school districts, then we would gladly like to have you at the table. And that's one way to start it.
Also, to kind of address your questions too, there is a young lady at the health department, Cassandra Stewart. I don't know if you're on her email list, but she sends out pretty much on a daily basis information about different health fairs that are going on and resources for the community. I'm part of the Great and Healthy Homes Initiative. I do outreach and education, so you're exactly who I look forward to talking to on a daily basis and coming to your school, do workshops with your staff to kind of give you overviews and kind of training on the resources and services that we have for the students and for the families, and then also to talk with the parents, so that you all are serving as a direct referral source to those families for the resources that are out in the communities. So there was an event here yesterday that we were set up for, where a lot of your colleagues were here. Family League, were you here? Okay, so we didn't get a chance to talk, so we need to talk. Okay.
I'm very intrigued by the concept of the health enterprise zones. And so I wasn't clear if you were funded or you weren't funded by that. And I'm also interested in how long it's been running and if there's been an evaluation in terms of reduction of heart disease and other indicators.
Health Enterprise Zone has been running now. Our collaborative has been in existence for a little over a year now, and we did not get funded in the first round. And what was stated in the Health Enterprise Zone is that for the organizations that did not get funded but fell in a fundable category, that the state would actually work with those organizations to get them funded. Well, it has taken us a little over well, not completely to the 1-year anniversary, but we actually did hear back from the state. Our application stayed in the fundable category, and we have now resubmitted with the state our second request for funding at their request. And we will not find out if the application gets funded until January. And so we have really been excellent at the table together, but we have been able to move that application in different pieces, as stated before, to Johns Hopkins, to the Annie E. Casey Foundation, and looking at other foundations and other opportunities to continue to get the other partners at the table funded. But we have stayed together as the collaborative. Does that answer? And in reference to cardiovascular disease, Dr. Michael Weisfeld has been at the table and has been keeping us abreast of what is taking place with the statistics of cardiovascular disease. And it is alarming to say that in East Baltimore that the numbers of relative to cardiovascular disease and death has not changed over the last 20 years. And so it is an area by which we do need to have a lot of concentration, and we do have a rigorous evaluation as a part of the HES, as well as what's now being called Tumaini, where we're walking on the bridge very closely together with Johns Hopkins. And one of our other things that I didn't share is the other day we were working on our marketing tools to put out the announcement to the general community as well as the community leaders. And when we designed our flyer, we had on there the Johns Hopkins logo, and they told us that we needed to remove it. And Leon was quick to say that I need to let it go because it was going to take us too long to get approval because it's a branded logo. Well, 2 days ago, I got an email to say it's not a problem, and that's another historical moment for the HES and the Tumaini group because of the fact that we've been making a lot of historical headways with Johns Hopkins in that we've been able to get the attention of the provosts. We've been able to get, funding and at a dollar amount that has not heretofore, to our knowledge, been done. So it's a lot of, just major things happening and change. And I'll say for President Daniels to actually enforce what he said, we don't want a whole lot of talk, we want action. And I have to give kudos to Dr. Blum for taking that on and really sticking with us as well to open doors that we were not able to open on our own, but we've opened together as partners.
After listening to the many presentations that were presented in Annapolis, we were by far the strongest, I think. And it's evident in the fact that several components of our proposal have now been implemented around the state of Maryland, and none of them had that at the presentation. We were the only one that had it. So, we weren't funded, and it was political. And we know it was political. Well, most of them won't say it. I'll say it. It was political, and if it wasn't, why are they stealing components of it now, using it all over the state?
Second